Hello everyone. So the case is a very important one. The case is called actually child with the vomiting. One of the very hot case in AMC Clinical. You all must be knowing the two very hot case that often comes like the child with the vomiting. This one of them is Pyloric Stenosis and one of them is ZERD. In another video, I'll be discussing about the ZERD. What are the key points? Now you need to understand how these cases are coming in AMC Clinical exam. Now the full case, from history up to the management, they usually don't give in the main exam. So the many time the cases would be coming history, then physical examination, investigation and diagnosis. In the another way that it can come, give the diagnosis, differential and the management. So I'm going to discuss you about the diagnosis, DD and the management. That one, actually the history one we're not getting into, those are different. We usually try to show our candidates how to take the history. Now the diagnosis, example pyloric stenosis, and it is very important. You need to know the DD and you need to discuss this DD at a certain point with the patient, or you have to tell to the examiner if it's required to. So one of the very important DD here is ZERD. Then there could be some cases gastroenteritis and some cases intestinal obstruction. A lot of certain other aspect might come regarding that, like you can also remember as UTI, you can also remember as septicemia. Like there is a word given in John Murtagh, serious disorder that should not be missed, always under the differentials actually. So this part, so the diagnosis and the DD, so that's gone. Next coming is the treatment part. Now treatment in case of pyloric stenosis, this is important, and you have to have a very nice flow while telling the patient. So I'll be highlighting you the main points where the examiner will cut your marks. Now when you start, you should have a very reassuring voice. That's very important, and the very reassuring face that, like in your case, in your kid, we are thinking this is a case of congenital pyloric stenosis, and it can be also some other condition, but most cases we are sure, especially from the clinical vaginity. All right, because pyloric stenosis most of the time we get to know by clinically, like especially in MC Clinical, but you should also tell in between, like there's some other test we do, like say example ultrasound. So we'll be highlighting that one in between. Now in case of pyloric stenosis, when we start with this is your case. Then why do you think this is the case? Now you have to tell, like okay, because the child is having vomiting. Just after giving food, the child started to vomiting, and when it started, actually it's from the very beginning of the birth that it started. So these are some of the key points for pyloric stenosis. Don't forget, like the baby remain hungry. I repeat, the baby remain hungry. Okay, so this is one of the very important point. And like sufficient gaining weight, it is not achieved. I repeat, the sufficient weight gain is not achieved. So these are the point when you tell the diagnosis. You tell the diagnosis. After that, you immediately tell, like okay, these are the point why I'm thinking, like this could be a case of pyloric stenosis and this is not the other thing. Then you proceed. Now you have to, there is a part, you need to draw something. So you just draw something with a, like in stomach, and this part is pylorus, and there is a like this layer, that layer, and there's like constriction in the pylorus part. So you have to draw, that has marks actually. So if you don't draw, probably there will be cutting down of mark. Now you also need to assess this situation by asking the examiner that it's an emergency condition, that you get to know by asking the vitals, or it can be written in your question as well. So if you get to know it's an emergency or the baby is dehydrated anyhow, so you need to make sure, or you need to assess the hydration. So like once the baby is rehydrated, in that case you can offer investigation and certain other things, and at the same time you tell the patient definitely that you would like to go for surgery if it's possible actually, because in congenital pyloric stenosis, like you need surgery. This is one of the main things. So it's also known as pyloromyotomy. In order to do the surgery, you need to tell the patient, and she needs to stop feeding of her kid. So this is very important. Some of the question might came from the role player, like can I continue the breastfeeding, like so for now it has to be stopped. So this is important. And later they can, of course. Now when they can after the surgery, the feeding thing is very, very common. In case of a worried mom, they will ask you. So answer is 6 hours according to RCH guidelines. So you have to tell this thing. Also, you need to discuss about the pros and cons about the surgery. So this is another important thing. So pros and cons of the surgery, the side effects. Sometimes the role player also asks, is this thing can happen again? You should tell, yes, re-stenosis is possible, but it's rare, like 0.5 to 1% cases it's possible. So these are the thing. Also, don't forget to add that word Piper team. Also, don't forget to add some of the few keywords: social worker, then central link. So these are the few point might come in certain point. Actually, sometimes immigration related question also come from the role player. So you need to be aware of all this certain thing. I hope so this will help. And we in the main classes and discussion, we like to help our candidates even more. Thank you so much. This is Dr. Shahriar. And don't forget to subscribe my YouTube channel, which is Shahriar Ahmed Shujai. Thank you so much.